Today we have the privilege of having Dr. Preeti with us. Dr. Preeti is presently serving as additional professor in the Indian Institute of Public Health, New Delhi. And she has done her MD in Preventive and Social Medicine and MSc in Public and Health Research. And she has a medical and public health background and has previously worked in routine immunization with the UNICEF Bihar in 2007 and 2008, where she was actively involved in program planning and implementation. And we can see that she has worked a lot in this field. She has also worked at Program for Appropriate Technology in Health in 2009 in New Delhi, and she provided technical assistance to the Government of India for planning and implementation of the vaccination against Japanese encephalitis. So today we have Dr. Preeti with us, and she will guide all of you students that how your degree, your course can be of value further if you venture into the avenues of public health, and how you can work further. You can have this background of public health as your future. You can work in policy makings, you can work in research. So I'm sure you will benefit a lot from today's lecture. So now I welcome Mr. Naresh Luthra ji, who is with us, who has actually facilitated this lecture for today. He's been kind enough to let Dr. Preeti to give a lecture over here and help you all students. And on the behalf of the Internal Quality Assurance Cell, KGMU, I welcome you all. And our Dean Quality and Planning, Dr. Apul, he was also wanting to join, but he is in some conference in New Delhi, so maybe he'll not be able to join actively. And on the behalf of all other members of our deanery, Dr. Anita, Dr. Shalini, Dr. Rameshwari, I welcome you, Dr. Preeti, Dr. Naresh, and I now give over the so that she can start her lecture.
Am I audible?
Hello, Dr. I can see you now.
Good afternoon. Yes, am I audible?
Yes, you are. Yes, you are audible.
Thank you so much. And yes, thank you very much for giving us this opportunity to interact with your students. And I'm really happy to see
your voice is a bit low.
Is it better now?
Can be louder.
Is it better?
Better now. Yes.
Yeah?
Better.
Okay. So I'm saying that I'm really happy to see the turnout in today's session, because being a Saturday, despite being a Saturday, so many students have actually turned out for this lecture. So I'll try and keep it not very long. I'll keep it short and very to the point. But I definitely want to introduce the students to the world of public health. Dr. Rhythm, if you could just give me a quick background, just a very quick thing about what this background of the students is. So they are students of medical sciences, or what is the background, and which year, mainly, are the final year students?
Yeah, mainly undergraduate students from the Faculty of Dental Sciences and the Faculty of Nursing, and a few students from MBBS background also. Mainly undergraduates from BDS, MBBS and nursing.
All right. And are they all final year students?
They are mixed.
Mixed. Okay. All right.
Doesn't matter.
Doesn't matter.
Third year,
public health.
Year,
Yes. All right. Yes. Okay. Thank you so much. Thank you. And thank you once again for giving us this opportunity to interact with you. I'll just give me a minute to share my screen, my presentation, and then we'll start. Just give me a minute. Huh? I think I'm having some, some problem with my connectivity. So if you don't mind, shall I keep my video off for now so that I'm heard better? You know, the bandwidth will be easier.
Yes, you can do that.
Is the slide visible?
Yes.
All right. Thank you, Nareshji. So we are going to talk today about avenues in public health. What are the different avenues in public health? And first of all, let's hear about what public health is. As Dr. Rhythm said, you're all students of medicine, dentistry, and nursing. I'm sure you already know what medicine is all about, but I myself am a medical background person. I'm a professional who has completed her MBBS and MD from a medical college, so I completely understand the preventive and social medicine and community medicine. But most of our studying during undergraduation or even post graduation for that matter is very clinical medicine oriented. So today what I want to talk to you about is what public health is and the importance of public health, especially in the Indian context, number one. And number two, if you ever think of going for a public health post graduation qualification, you can always sort of think of taking up public health or masters of public health or MSc as one of your career choices. Okay, so we'll talk about that a little bit from now. So I'm going to talk to you a little bit about who we are, that is where we come from, what work we do, the importance of research in public health, what avenues you have in public health, what you could do in, because people will always ask me, students especially, they ask me after the webinar is over, ma'am, after finishing MPH or MSc, what are we going to do? You know what you do when you become a doctor. You know what you do when you become a dentist or a nurse. But when you become a public health professional, what do you do after that? What are the kind of jobs you will get? So naturally, these are natural and common questions that are asked. So I would like to tell you a little bit about that as well. And then also, what IIPH Delhi, the place where I teach as faculty, we teach public health. I, of course, teach only a few subjects within that vast discipline of public health. But at IIPH Delhi, what do we have to offer in that area? That also we will talk to you about. And then, of course, we'll give you an opportunity to ask questions. So, to tell you a little bit about Public Health Foundation of India, which is our parent organization, PHFI was launched in 2006 by then Honorable Prime Minister Dr. Manmohan Singh. And this was launched or started off as an independent foundation, registered as a society with initial funding from the government. We got some seed money from the government, but we were allowed to run it as an autonomous public-private institute. So our work primarily, or our mandate, our mission, our vision is to strengthen public health systems in India by building public health institutional capacity. What does it mean? It means, what is a medical college doing? Or what is your nursing college? Or what is your dentistry college doing? They are churning out dentists. They're teaching you how to become future dentists. They're teaching you how to become future doctors or future nurses, isn't it? Similarly, our institute under PHFI is teaching students to become public health professionals. Why? I will tell you in the coming slides. Why do we need public health professionals? So, what do we do? What does Public Health Foundation of India do? We basically are a public-private partnership where we're working closely with the Union Government, the Ministry of Health and Family Center that is based at New Delhi. And we're also working with other state governments. We have a lot of projects that we work with health departments, ministries of health, etc. We also work with development agencies. Say, for example, the UN agencies, WHO, UNICEF. We work with NGOs, national and international NGOs, health NGOs, other department NGOs. We work with industry leaders. So, for example, let's say you have the CSR Foundation, the Corporate Social Responsibility. HCL has a foundation. Infosys has a foundation. So they have a part where they're supposed to be supporting research, where they're supposed to be supporting public health practice. One way in which you can connect with the community. They have that mandate, all right? All these big industries. Tata Trust, for example, that's a CSR component of the Tata group of companies. We have the HCL Foundation, we have Infosys Foundation. There are so many more. All right. We work with them as well because they have the financial capacity, but they do not have the technical capacity. So for technical capacity, they approach us, and then we join hands with them and we conduct research in various fields of public health, in various areas of public health. Our overall goal is to prevent disease, to promote health, and lay down benchmark standards in public health education. That is basically what we do. So if you ask me, what am I am a doctor because I have a medical degree. But more than that, I am a teacher because my job is to teach students public health. Okay. And what is public health? Primarily, I'm sure you'll have been studying this in your PSM or your public health dentistry or nursing. But primarily, public health is about prevention. Yeah. We have so many diseases that we see nowadays, which you see much more nowadays than you used to see, let's say 20 years back or 30 years back. Cancer is one such disease. Heart disease, yeah, cardiovascular diseases. You see very young people in their 30s, in their 40s, sometimes even in their 20s, they're getting heart attacks and they have to undergo bypass or they have to undergo angiography, angioplasty, and so many other things. My point is that things that, if you think what used to happen in the 40s or 50s or 80s also, the same thing will happen today. That's not possible. That is not happening. Cancer. A lot of cancer we are getting to hear, about. A lot of people, you might have heard in your family, your relatives, amongst your friends, parents, isko cancer hua, usko cancer hua. ये पहले इतना नहीं सुनाई देता था. Why is it happening now? One, you might say, because the diagnostic facilities have improved. So the detection of cancer today is much better than it used to be, say, 30, 40 years ago. Or we have better, understanding of how cancer develops. And therefore, we are able to pick up cancer much faster and in a much better way than we used to do, say, 30 years back. So there are different factors behind it, but the point still stands is that our incidence of cancer is definitely going up. One of the other reasons for this is environmental change, our environmental influences. Look at the food we eat. 40 years back, I remember when I was in school, my parents used to always say, "Ghar pe khana khao." Whatever happens, you eat. Even if it's simple dal chawal, you eat food at home. Vegetables, fruits, jo bhi hai, healthy khana khao. Today, what happens? Even parents are working and they have no time to cook at home. So whatever is being cooked may not be of good quality. And bahar ka khana, which essentially is more junk than healthy, has made its way into the households. Yeah, and generally, if I give you a bowl of rice and I give you a bowl of pasta, you're going to be preferring pasta over rice. If I give you khichdi and I say instead of that you have pizza, you'll prefer pizza over khichdi. Nobody will serve you khichdi for a birthday party. They'll always serve you pizza. Or आप साल में ऐसे 12 या 15 birthday parties करोगे, how many times are you having that junk food? And other times also. My point is our lifestyles have changed drastically as compared to what they used to be some 30, 40 years back. So therefore, even then it was important, but now it has become even more relevant or more important or more significant to prevent disease, to know what we can do to prevent disease and promote health. That is becoming very, very important. So this is what we do. We basically teach our students who are doing their masters in public health or who are doing their MSc in clinical research or even ones who are learning about public health management, how to get the community to promote health and prevent disease and live a good quality life. There are different aspects to it. If you see the thematic areas that I have on the slide here, you'll be able to see them. We work primarily in these areas. Our research is primarily in these areas: maternal child health, mental health. Mental health is coming up in a big way now, especially after COVID. So हम सुनते ही रहते हैं किसी का suicide, किसी का depression, किसी का और कुछ. And weird, just a few days back, there was an incident in one of the Noida में college में एक incident हुआ है where a boy shot a girl and then he committed suicide himself. These are mental health. I never heard of these things, before. What is going on in the minds? It's important to talk. It's important to interact. But how is that going to, that evidence needs to be generated. Somebody needs to bring this out in the open, give it that importance that it deserves, and talk about it and do something about it rather than just sitting. You and I know it in silos. हम अपने घर में बात करेंगे, हम newspaper में पढ़ेंगे, and then we'll forget about it. नहीं. We are not supposed to forget about it. We're supposed to do something about it. Nutrition. Anemia, still a big issue. इतना हम खाना खाते हैं, इतना हम fruits लेते हैं, इतना सब कुछ करते हैं. Despite that, there is so much of anemia. Why? So these are issues which need to be thought about, which need to be implemented in terms of research, in terms of policy, in terms of health programs. So we do that sort of work at PHFI. Okay, so if you see, there are other areas that we work in as well. We work in violence against women, environment health, infectious diseases, non-communicable diseases. Infectious diseases, naturally, I mean, all of us have faced COVID the last couple of years, and we all know the importance of infectious diseases, right? Tuberculosis, for example, बहुत पुरानी डिजीज है and it still continues to stay. कोविड के चक्कर में ट्यूबरकुलोसिस थोड़ा सा neglect किया हुआ, उसका incidence फिर बढ़ गया, and now we are again having a spurt of cases of tuberculosis. And so infectious diseases तो है ही. We have dengue every season. अब monsoons शुरू होंगे in another couple of weeks, and then we'll have dengue cases coming in. We know what is there. What we need to know is how we can prevent it, what we can do to make sure. Okay, then there are areas of sanitation, injuries, health system, health financing. This is again very important. No, insurance, pharmacoeconomics, drugs related, health drugs related. Pura ek industry hai pharmacoeconomics. So a lot of information is required on that as well. Disabilities, nutrition. So this is where we work. These are the areas under the aegis of public health in which we work. And what we do in terms of working, when I say we work in these areas, what do we do in these areas? What kind of work? So as I said, our basic mandate is teaching. We teach students about this. We teach students about public health nutrition. We teach students about environmental health or mental health or infectious diseases or non-infectious diseases. We teach them that. So that's our primary job, our primary work. The second we do is we can usko statistics, which is a statistical software or SPSS or some other software. So we have workshops for that. We call them training workshops. And we have a full workshop series जिसका list होता है हमारे website पे upload होता है. You just have to pay, you have to register and enroll for those workshops. So we do that as well, because everybody may not be wanting to learn everything. They may want to learn in piecemeal. So we have those options available as well. The other one is the our postgraduate, our on-campus programs, our e-learning programs. Some people who are already working, they're in service, not like you. You people can take up a full-time 2 years course because you are still in the student part of your life, your phase of your life. But there are people who are working, they're early career people, but they want to enhance their skills in a certain area. So they say, I cannot come and stay in Gurgaon. Our office is based, our institute is based in Gurgaon. So they say, we can't come to Gurgaon and stay for a year. But if you have an e-learning course to offer, let's say in epidemiology, you have a course in nutrition, or you have a course in health promotion, we can take up that course because it's a fully online course. We call them e-learning. E-learning means electronic, right? So we have that opportunity as well. And then we have the PhD programs as well. So this is what we offer. I'll tell you more about them in the last few slides. But this is just to give you a glimpse of what we do in PHFI as far as our academic programs are concerned. Now, to tell you about where we are based, as I said, our office, our institute, which is the Indian Institute of Public Health, Delhi, is in Gurgaon. And we also have other institutes under the aegis of our parent organization, that is PHFI. We have one in Gandhinagar, we have one in Hyderabad, Bangalore, Bhubaneswar, and Shillong. So these are our institutes. They're all sister institutes, and they're all under the parent organization, one parent organization, that is PHFI. So now we'll come to what is the importance of research in health. I was talking to you a little about this earlier, but just to reiterate, the WHO organized measures, public or private, to prevent disease, to promote health and prolong life among the population as a whole. I was talking about cancer some time ago. You heard about cancer in somebody's family, maybe your friend's family or your neighbors or your relatives or whoever. If you hear about cancer, you realize, you feel bad for the person, you feel bad for the family, because you feel, oh, they're suffering so much. Now they're going to be suffering more, and who knows what the outcome will be. And we always pray for speedy recovery, and we hope that the person comes back to normalcy as soon as possible. But that may not happen all the time. Yeah. In such situations, you'd rather say, I hope there is some way I can find out if a person has cancer at the earlier stage itself, yeah, right? When the cancer is in the first stage, and you can quickly do surgery and just get it out and get it over with. Wouldn't you rather want that? Or even better, think of a way in which you can prevent cancer. What are the factors for which you will need to know? What are the factors? No, what are the factors that you have? Say for breast cancer, for example, what are the factors for breast cancer? If you know that, you'll be able to prevent your breast cancer. What are the factors for cervical cancer? What are the factors for lung cancer? What are the factors for brain cancer? If you know that, then only you'll be able to prevent it. What are the factors for heart disease, for example? We always say, oh, eating a lot of fatty food, eating a lot of junk food, we want you to avoid it. That is why we want you to exercise. That is why we want you to be physically fit, etc., etc., etc. So we know the factors for them. We know what can we do to prevent them. We know what we can do to promote health. Smoking, for example, we know it is injurious to health. We know it is bad for lung cancers. So we know we should be, and therefore there's a policy. But where did all this come from? To start off with, how did we know that smoking is bad for lung cancer or smoking causes lung cancer? How do we know that cholesterol leads to heart disease? How do we know that eating too much of salt or too much of that will lead to hypertension? How do we know all of this? We know all of this because of research which has been done in that area. Somebody has worked in that area. Somebody has, thought about it. Somebody has done a very scientific study or more than one scientific studies to know what is to be done to avoid cardiovascular disease or to avoid blood pressure problems or to avoid tuberculosis. During COVID, all of us were told to wear masks, N95 mask and move. Where did that come from? That came from the fact that the COVID-19 virus was thought of, then later on we came up with a theory it's probably airborne, but initially there was a thought that COVID-19, the virus is spreading through the droplets. Now, when it spreads through the droplets, what happens is the droplets are hanging in the air, no? And then it can, through the air, it can go on to someone transmitted. So we wanted to avoid that, and therefore we asked everybody, please make sure that you wear well-fitting masks. When you're inside, you stay in a well-ventilated area, etc., etc. Where has all this information come from? Not just like that, no? It has come from the fact that somebody must have done some research and identified that this is the best way that we can save people. Vaccine, right? Another big, breakthrough. When the vaccine came and we realized that people who have taken the vaccine have, a better chance at preventing COVID as compared to, or even, the COVID that they will suffer, even if they get the infection, probably will be a much milder infection as compared to the others who are not vaccinated, right? So these are all ways in which public health works. This is all that public health has to offer. The core functions of public health, as I just now said, are assessment. You assess what is required. What are the basic problems? Our problems are infectious disease. Our problems are vector-borne disease. Dengue is a problem for us in India. TB is a problem for us in India. Nutrition, malnutrition is a problem for us in India. Anemia is a problem for us in India. We need to do an assessment first of how many people are suffering from this problem in India, or even abroad for that matter. But I'll talk about the Indian context here because that's where our primary work lies and our requirement also of public health professional lies. So we do an assessment. We need to find out who are the people. It's not just how many, who are the people? Are they more younger people? Are they older people? Are they people living in the cities? Are they people living in the slums? Are they people who are working in a certain occupation, etc., etc.? So that sort of assessment is done under public health as one of its core functions. The second core function is policy development. When I say policy development, I mean based on the results that we get from our assessment, we know what is to be done. So government comes up with schemes, no? There's a Swachh Bharat Abhiyan. Why did we have Swachh Bharat Abhiyan? Because it was realized based on these assessments that we need to have a cleaner India because environmental health is a big thing that's coming up, right? We need to have cleaner India with nobody defecating in the open. Everybody should have access to a toilet. Everybody should use a toilet, right? So this is a policy decision. This decision you and I cannot take alone. These decisions will have to go to the ministry. People sitting there as senior officials will take a decision in favor of this and say, yes, we will provide money. Because you say, you go to a village, poor person in a village and say, you know what, you should not defecate in the open. Please use a toilet. He says, I don't have a toilet. I don't have access to a toilet. Build me a toilet. You cannot say, oh, you go and build your own toilet. Because उसके पास पैसे ही नहीं है. वो कहाँ से बांधेगा toilet और कहाँ से use करेगा? He say, I'm happy defecating in the open. But if you want me to use a toilet, please build me one. So that is how the whole Swachh Bharat mission and this building of the toilets under that scheme started. Today, our open defecation levels prevalence has gone down. It's much, much lower than what it used to be because now people have access to a toilet, a working, functional toilet. Now, these are all core functions of public health because you want to see a healthier India. You want to see a cleaner India. You want to see a greener India. So public health will help you to get to that. Then, of course, you need assurance. Why assurance? Because if I am to tell you, कल से please सब लोग ना mask पहन के office जाना या school जाना या college जाना, you will say, why should I listen to you? What is the basis for this particular statement? Or even more, if I tell you from tomorrow you don't need to wear a mask. अब COVID चला गया है और अब आपको कल से mask पहनने की जरूरत नहीं है. You must have read in the newspaper or seen it on TV or watched it in the news. WHO recently announced that COVID-19 now is no longer a public health emergency. Okay? What does that statement mean? That statement means कि हम जो pandemic कर रहे थे पिछले 2 साल से and everybody had thought about it as this big global emergency, that emergency status for COVID-19 is now been removed. But that does not mean कि COVID-19 चला गया. Please understand the difference. Unfortunately, the moment WHO came out with this sentence, everybody says, oh मतलब COVID चला गया, oh मतलब COVID चला. नहीं, COVID नहीं गया. कोविड अभी भी है. आज भी मुझे या आपको या किसी को भी कोविड हो सकता है. वी स्टिल हैव टू बी केयरफुल. जस्ट लाइक वी हैव टू बी केयरफुल फॉर अदर डिजीजेस. आपको डेंगू भी हो सकता है, मुझे टीबी भी हो सकता है, होने को तो कुछ भी हो सकता है. सो nobody saying COVID is gone. All that WHO said was that COVID now is no longer a global public health emergency. हम उसको वो जो स्टेटस दे रहे थे in the last 2 years, वो स्टेटस अब उसका वैसा नहीं रहा. It is just another infectious disease like the other infectious diseases. So you will still be treating it as when you see a patient, लेकिन आपको उसके लिए डरने की जरूरत नहीं है जिस तरीके की emergency वो थी about say a year ago or 2 years ago. Now this also comes from some evidence. To bring up a statement like this and to tell this to the entire world, you have to be more than 100% sure कि आप जो बोल रहे हैं वो सच में वैसा है. And that assurance again comes from research. So these are all core functions of public health. When you invest in public health, you're making a wise investment because you're preventing disease, you're promoting health. So it helps people to save money. It helps people to enjoy good health, good quality health, and it helps them to live longer. Okay? Research is a complex process. You see here there are lots of arrows going in all sorts of directions. But the idea, if I had to tell you this very simply, and we teach this, ये जितने भी यहाँ पे आप देख रहे हो triangles or rectangles or bullet points, we teach all of this at Public Health Institute under research. But what I'm trying to tell you here is that whenever you want to find out facts, especially with respect to health, you need a very systematic investigation, a very scientifically sound, technically sound investigation for any area. It could be anemia, it could be nutrition, it could be heart disease, it could be cancer, it could be anything, mental health. But if you want to know some facts about mental health, you're going to have to make or do a systematic investigation of that. And then there's money involved, there are resources, you're going to need people. There are lots of things that will go into actually building those facts. Okay? So we teach all of this at IIPH Delhi. Why is my slide not moving? Just give me a second. Huh?
Yeah, now it is moving.
It is moving now, na? But I just need to take it back to the.
Yeah, now we are.
Yeah. Okay. So I will not spend too much time on the next few slides because I've already talked about them. But just to give you quickly a glimpse of what are the different types of health research, we have the basic research, which you do in a lab, which is very ideal situation research. But the moment you take it to the field, the moment you take it to the community, and that is what public health is. Public means population. So the moment you take it to the community and you say, I want to do a field-based research, there are many other factors that come into the picture. Because people behave in a certain way, and everybody behaves in their own, own style. Each of them has their own behavioral patterns. So you want to make sure that you take into consideration all of those factors, whether it is field related or lab related, and come up with answers that are relevant not only for those who are part of your study, but for a wider population. That's important. And whatever facts or findings you get from your research, they should be usable and applicable to a wider population. So you need to take into account all of those things when you conduct research. We've learned a lot of lessons from COVID-19. I'm sure all of you will agree with me, whether it was about origin. I'm sure you've heard it because you come from a medical, university, as even as dentists or as nurses. I'm sure you've heard of this word epidemiologist or epidemiology. Now, I'm an epidemiologist, all right? But people did not know, my own friends, for example, who are not from this medical field, did not know what I did, or they did not know this word epidemiology. But because of COVID-19, everybody knows what an epidemiologist does, right? And the work of an epidemiologist. So outbreak investigation is the work of an epidemiologist. Finding out patterns, finding out trends is the work of an epidemiologist. All right? We can work in labs. We can do basic genome sequencing. We can work in the area of vaccine development. So there are so many things, whether it was origin, whether it was diagnosis, right? We wanted to make sure how it was diagnosed. So all this RT-PCR and your RAT, your rapid antigen test, all these diagnostics came up at the time of COVID. And, now we have a lot more information on COVID than we used to have, say, 2 years back. Treatments changed. Almost every 6 months, there was a new line of treatment that was available. Every time trying to make the previous line of treatment look a little shady or faulty or not so clinically applicable. So my point is that, because of COVID, a lot of research got importance. Vaccine development got importance. Health insurance, for example, got importance. In general, public health management at a community level got a lot of importance. People got to know कि अच्छा public health भी कुछ होता है, because otherwise, sometimes and I'm not trying to undermine the work that was done by clinicians during this pandemic period. It was phenomenal the way they have worked day and night, endlessly, tirelessly, and for everyone who has given his or her support to this pandemic during that period. But the public health workforce का जो काम था, although most of it was at the back end, but now people have started recognizing कि हाँ ऐसे भी कुछ होता है, and a lot of our students, ever since the COVID-19 pandemic happened, they come up to us and say, ma'am, हमको ना COVID में कुछ research करना है. या जैसे if you remember when first vaccine came and there was this whole questioning about क्या ये vaccine सही में अच्छा vaccine है, should we be taking the vaccine? There was a lot of vaccine hesitancy. And people were not sure कि लेना चाहिए नहीं लेना चाहिए. So at that time it became important to tell them कि this is part of public health. वैक्सीन क्यों लेना चाहिए, वैक्सीन नहीं लेना चाहिए तो क्यों नहीं लेना चाहिए, किसको नहीं लेना चाहिए, why is booster important? right? So all this comes under public health. And why am I saying this again and again to you is only because, public health never, or in the last so many decades, public health unfortunately never got the kind of importance that it deserved. That is the unfortunate part of it. Public health तो पहले से था, ये कोई नया field नहीं है. But people never knew it the way they know it today. And that has come in from COVID. COVID की वजह से हमको काफी कुछ information मिली है public health related, which I think should go out to the normal, the non-medical background people as well. But even from within the medical field, or whether it is dentistry or science, nursing, field, even you should know कि ठीक है, you can take up nursing post graduation के लिए, you can take up a nursing subject, you can take up a dentistry subject or a medical subject, definitely. But this is again an option that you can think of. Another big reason, and where public health becomes important, is our mortality. You look at the table here, and you look at the mortality that I have presented here for India and compared it with mortality in China, in Brazil, in Sri Lanka. China is a big country just like ours, but look at the difference in the neonatal mortality rate. Neonatal mortality means mortality of children in the first month after they are born. Within the first 28 days में उनकी मौत हो जाती है, for whatever reason. Infection is the most common reason, and nutrition also is another reason. But look at the difference in the rates of India and China, or Sri Lanka also for that matter. Major difference, more than 7 times difference. Under 5 mortality rate, मतलब बच्चे जो 5 साल के मतलब 5वें बर्थडे से पहले उनकी मौत हो जाती है. Here again we have 34.3 as a rate for India versus 7.9, 13.9 and 7.1 as a rate for China, Brazil and Sri Lanka respectively. Immunization rates देखो 91%. This is again a little, अभी ये कोविड के बाद, ये कोविड के पहले के estimates हैं, कोविड के बाद के estimates और भी नीचे चले गए, because in COVID a lot of children missed their immunization. Birth by skilled attendants. A lot of children are still being born at home. Out of every 100 children, at least 20 children are still being born at home. And they are not being attended by anybody. When you don't have an attendant at the time of childbirth, there's going to be some infection. The mother can die of postpartum hemorrhage. The child can have problems, breathing problems, asphyxia, etc. And who's going to take care of all of that? Somebody who knows will be able to take care of all. Somebody who's trained, right? So this is all important to know because at public health, in the public health field, we are addressing these issues. For us, because in clinical medicine, you will not look at neonatal mortality rate. A pediatrician, I'm not, again, I have the, utmost respect for all clinicians, myself being a doctor. But a clinical doctor will only see the patient who is coming to his or her clinic. उनको नहीं पता चलेगा, because of the design of their work, उनको नहीं पता चलता कि उनके हॉस्पिटल के बाहर क्या हो रहा है. उनको बस ये पता है कि हमारे यहाँ हॉस्पिटल में क्या हो रहा है. And let me tell you, a lot of clinicians are now moving towards research. They want to understand कि अगर कैंसर के इतने सारे पेशेंट्स मैंने पिछले महीने में देखे जो मैं कभी नहीं देखती थी. I have seen many more cancer patients now than I've ever seen in the last, say, 5 years or 6 years. Then there's something wrong. Why am I seeing so many cancer patients now? They want to find out. But they don't have that kind of research background. So they get back to us and say, can you people please help us in doing research in this area? And we would like to understand why we are seeing so many cancer patients now as compared to 5 years back. We can do research of that sort and find out. And that is what public health does. So in India, our problem is that everywhere else we are progressing. Everywhere else we are doing very, very well. In the health area, it's a development paradox. We're such a big country. We are now the most populous country in the world. But despite that, we are not progressing as much as we should have by now in the area of health. And that is what we need to look at. That is what we need to work on. I told you earlier about a lot of these programs. Ayushman Bharat is basically for developing health and wellness clinics, and providing some health insurance for the below poverty line families. And then there's a Swachh Bharat mission, which all of you must have heard about. There are many other programs. There's a health program for cancer, there's a health program for diabetes, there is a health program for hypertension also, there's one for blindness also, there's one for dengue also, there's one for malaria also. There are many such programs. But who is going to run these programs? Who is going to make the policies or give the evidence to help or support those policies, to guide those policies for these programs? Because these programs cannot be going on and on and on. At some point, you have to stop it, because every program has a financial implication. There's a budget involved, and crores of money are utilized in a program like Swachh Bharat or an Ayushman Bharat. So where are you going to get all of that from? Who will generate the evidence to say, okay, now I think our country has become clean enough. Everybody is literate with respect to use of toilet or washing of hands with soap after using a toilet. We do not need the Swachh Bharat program as a program. अब लोगों को अपने हिसाब से अपने लेवल पे, इंडिविजुअल, कम्युनिटी लेवल, नेबरहुड लेवल पे वो कर लेंगे. Are we in that position today? Not yet. We still have a lot of people who feel नहीं, हमको तो बस टॉयलेट यूज नहीं करना, हम तो खेतों में जाके करेंगे, हमारे लिए वही ठीक है. Somebody needs to make them literate. Somebody needs to go there and tell them कि नहीं, आप ये नहीं कर सकते, because this is injurious to health, and not just your health, you're putting other people's health at jeopardy as well. So that is what we need people for. We need public health professionals to help us with running the programs. We need people who will help us with making the recommendations based on research, based on evidence. We need people who can do statistical analysis, use data, and interpret those findings. Analysis कर लिया, उसके बाद क्या? या सॉफ्टवेयर ही यूज करना नहीं आया, तो फिर उसमें क्या करेंगे? So this is the kind of thing that we need people for. So we have programs. Now we're coming to the programs that we offer at our institute, which is the Indian Institute of Public Health, Delhi. And as I said, you're based out of Gurgaon. And we have multiple courses. I told you about the e-learning courses before. I told you about the short-term courses before. Now let me tell you a little bit about the on-campus courses, which is our, flagship. These are our flagship courses, because this is where we need people to come and be in Gurgaon for the duration of the course. It's the full-time courses, and this is what we offer. So one of the courses that we offer is the Master of Public Health course. This is the MPH course, conducted jointly by PHFI and the Academy of Scientific and Innovative Research. It's a full-time 2-year course, and each one of you is eligible. As you can see here, under the eligibility criteria, we have people with graduate qualification in medicine, Ayush, dentistry, nursing, pharmacy, veterinary sciences, physiotherapy, occupational therapy. They can all apply. Okay. Also, applicants with graduate qualification in life sciences, biotechnology, statistics, biostatistics, management, engineering, demography, population studies, nutrition, sociology, psychology. So you see, the list is quite a wide, we have a very much wider scope for students to apply to this course. And this is not be in English. All applicants should have basic computing skills and proficiency also in the language. Currently, we are open to receiving applications, and the last date for receiving these applications is 30th of June 2023. What do our MPH students learn? In our MPH course, we are preparing students to become researchers, number one, to become managers. And when I say managers, I'm talking about public health management, because public health is not just about learning the subject, but it is also about managing the community. It is also about managing people's behaviors. If you need them to change their behavior, you will have to program your work accordingly. So you need to prepare students to think in that direction. Very critical thinking, very analytical thinking. They need to have a problem-solving bent of mind. Okay. We prepare students to undertake public health research in institutional setting also and field setting also. We prepare students to work in socially, culturally, and economically diverse populations by being attentive to the needs of vulnerable and disadvantaged groups, because we work with, let's say, disabled children. We work with people in the slums. We work with people in homes where they are given food to eat. Malnourished children are kept in what's called as nutrition rehabilitation centers. So we ask the students to go there to understand what kind of management is done there, to see if there's any scope for improvement, provide recommendations, etc. So that sort of work also goes on, but we need to prepare the students accordingly for that. So in MPH we do all of that. A similar one-year course, which is called the Postgraduate Diploma in Public Health Management, is another course that we offer on our campus, IIPH Delhi. This is a one-year postgraduate diploma program, a fully residential one-year program. And people who are from the medical background, dental background, Ayush, veterinary, nursing, pharmacy, and physiotherapy, lab technicians, they can all apply. People from life sciences, biotechnology also can apply. The advantage is that, one, this is supported by the Ministry of Health and Family Welfare, and there's a whole consortium of institutes that is running this course across the country. In fact, the other IIPHs that I talked about earlier are also offering the same course in their respective institutes. So because this is supported by the ministry, we do get a lot of nominated candidates as well for this program. And what they do is, the states that are closer to the institutes, that is where their students will be sent. The graduates will be sent. So we receive a lot of students from, say, Bihar or UP, even Uttarakhand or Madhya Pradesh, Himachal or Haryana or Punjab, because the northern states is where we are, because we are located in North India. Therefore, the northern states is what we generally get. But that doesn't stop the other students from coming in and applying to this course. I told you earlier that the PGDPHM partners have a consortium, and the same course is applicable to all the institutes where we have our presence. The third program, so I'll talk to you about the MPH, that is Masters of Public Health. I talked to you about the PGDPHM program. Now I'm going to talk to you about the Masters in Clinical Research. This is an integrated Masters, followed by an option to enroll into a PhD. So you do a full-time 2 years master's program in clinical research. And then if you cross a certain CGPA, then you have an option, if you wish, to enroll into a PhD in clinical research. So that opportunity is there. And this course is also affiliated with ACSIR, that is the Academy for Scientific and Innovative Research. So very similar to MPH is the eligibility criteria for the MSc course as well. For this MSc course, however, because this is clinical research, a lot of biotechnology, zoology, life sciences students apply for this sort of a course. Whereas for the MPH course, we have more dentists coming in, more Ayush graduates coming in, physiotherapy graduates coming in. So we'll have lesser of them in the MSc course. But then we have had, having said that, we have had dentist students also doing our MSc course. In fact, a lot of our dental students take up MPH. Some of them have done MSc as well. But majority of our MPH students are dentists, physiotherapists, and Ayush graduates, and few MBBS graduates for our on-campus courses. The unique features of our academic programs include the fact that we use a competency-driven curriculum. We don't have textbooks, set textbooks and say, okay, for epidemiology, this is one textbook. You read this from first page to last page, you will pass. Aisa nahi hai. You all are doing that in MBBS as well. Hai na? You all read multiple books. For different things, you read different books and you get knowledge from different sources. So similarly, in our programs also, we use different sources for different subjects. And we do give a lot of our own notes. We have a library. But the whole idea is that we need to build what's called as a competency-driven curriculum. We want them to build skills. We have highly experienced multidisciplinary faculty. I told you that I'm a medical doctor and I'm also one of the teachers in this course, but I'm not the only one. There are others as well. And everybody is not a doctor. We have nutritionists, we have PhD nutritionists teaching nutrition, we have a PhD in statistics teaching statistics, we have a PhD in, say, modeling, infectious disease modeling, that is teaching modeling. We have a PhD in economics, that is teaching economics. So it's like that. We have a very highly experienced multidisciplinary faculty. We do have linkages with public health practice. We take our students to the community. We show them what the field looks like. We give them an opportunity to conduct research in the field as well. And that gives them an exposure to what population health or public health really is. There is an emphasis on problem solving, case-based learning. We give them a lot of practical to do as well. It's not just theory and everything, but it's also a lot of practice, a lot of tutorials, a lot of hands-on learning goes on while we are teaching them. Our focus is on transformative learning. We do use the learning management system because nowadays it's very difficult to not use our electronic methods, for teaching. We do use a little bit of our electronic methods also, but only very sparsely. More of our teaching is very hands-on and in the field. So the students are experience, and the learning is self-paced because I for one always tell my students my doors are open for y'all to come and sit and just have a chat with me, or if you want to come in and ask questions, you can do that, and so on and so forth. So there's never this there's never a moment where everybody feels disconnected. We're always connected with each other. We're always interacting with the students, and the atmosphere that way is quite congenial. Where do our students go? Our students our students are, as I told you earlier, they come from different backgrounds. So we've had students who have come in from dentistry, a lot of students who have come in from dentistry, nursing, physiotherapy, Ayush, Ayurveda background graduates, homeopathy background graduates, a lot of them have come. Statistics background, life sciences background, veterinary background. We've had students coming in from the veterinary background and doing very well. In fact, I remember one of the toppers from one of the batches was from the veterinary background. And then biology background. So we've had different, students coming in from different areas, and they've all come here. They've done their public health, or they've done their MSc or public health management, and now they have gone back. Where have they gone? They have gone to contract research organizations. They have gone to biotechnology companies. They have gone to pharmaceutical industries. They have gone to medical device companies. They are also doing, some of them are into what's called as pharmacovigilance. They are involved in regulatory affairs, ethical affairs, auditing of clinical trials, medical writing. So some of them are doing medical writing. Some of them are purely into data management at, let's say, laboratories or clinical research organizations. Some of them are into pure research also. And, some of them are in UN agencies. Some of them are in the ministry. Some of them are with health departments at the state level, in the Ministry of Health. So there are different places where you could get jobs after your research is, your courses is over. Just give me a minute. For some reason, my slide is stuck again. Yeah. So I told you earlier also that there are lots of different job opportunities. Excuse me. Really sorry about this. There's some issue with the slide changer. Okay. If you can see here, I have the logos of some or not all, some of the organizations where our students have been placed. Because at IIPH Delhi, and in fact at PHFI itself, in all our IIPHs, we have what's called as a placement cell. The students are naturally going to ask कि मैम आफ्टर वी डू MPH और MSc उसके बाद हमको जॉब कहाँ मिलेगी, तो कैसे मिलेगी? तो then we are there to support you. The placement cell basically is taking into account they facilitate your job. So for example, the placement cell will help you first in building your CV. It will teach you how to, let's say, prepare for an interview. It will teach you how to promote your skills. It will teach you many other things related to the placements, and then it will facilitate the placement for you. Placement is based on your performance, whether you get placed or not, what package you get, all that depends on your your skills, your performance at the end of the day. But there is somebody to facilitate and tell you, oh, there's a job available with so and so agency, they're looking for somebody with a skill in data management, would you be interested? Please send me your CV, I'll forward it. So that placement cell does that sort of thing, and they do it round the year. So students have been placed not just in Delhi but also outside, and they're very well placed because sometimes it's not just the package in terms of the remuneration, but it's also the kind of job that you get, the skills that you are able to apply in the field, that makes a lot of difference. So they may not have started off at a very, very high priced job, but something which has given them an opportunity to learn, something that has given them an opportunity to absorb, to perform, and that performance has spoken for itself. And then in the coming years, then they've landed up with much, much better and much more, in terms of the salary, much, much better jobs. So finally, if you have to apply to our courses, this is more for the students who are in their final year and might want to consider applying for an MPH or an MSc with us. This is what you need to send, right? You see the link on the slide. This is where you will get the brochures and the information about the courses, all the details. You can then apply. There is an online application form that is available. You need to fill that out and need to send that to us, along with your latest CV, contact details of 3 referees, and your certificates, your credentials saying, what you've done, what you've completed, where you've completed it from. And we will also need a 200-word statement of purpose, which means we want to understand what is your interest. You can't just take up an MPH or an MSc for the sake of taking it up, right? We'll need to definitely have a statement of purpose for the application as well. I'm really sorry about this. There is some issue with the slide changing. Yeah. So once you have submitted your application, which is due to happen anytime on or before the 30th of June, then we shortlist. There is a criteria that is laid out in the brochure itself, based on your qualification, based on your work experience, etc. We shortlist the candidates, the applications that we have received. Then there is a face-to-face interview that happens, and then the final decision is taken. There's a committee which makes that decision, which was then communicated to the students by early August, and mid-August is when we start with our batch. So mid-August our courses will begin, and we will then it's a 2-year stint from that time onwards. To give you a quick glimpse of what our student body looks like, what are the activities. If you see here, we've also been involved in a lot of cultural activities, a lot of other extra curricular health related activities. We ran a blood donation camp at our institute. We had our cultural festival where you can see some students playing some sports and engaged in cultural activities. So we have quite a vibrant life at IIPH Delhi, and we do they're also very busy with their modules and their exams and their other things, but it's not just studying. We do a lot of other things as well, which allow the students to, sort of show their, they get to develop their hobbies. They get a lot of time to do things besides studying as well. This is just to give you a glimpse of the kind of on-campus courses that other IIPHs under PHFI offer. And I told you that we have institutes based in Gandhinagar, Bangalore, Hyderabad, Bhubaneswar, and Shillong, besides IIPH Delhi. These are the programs, and you'll find details of all of this on our website. These are our e-learning courses. Different courses have different durations. Some of them are 1 year long, some of them are 6 months long, some of them are 3 months long, so on and so forth. And this is going to be my last slide, basically, just to give you idea that if you have any further requirement in terms of information, these are the email IDs where you can connect with us. And the 3 people whose names we have given are the program officers. They have all the administrative information that you might need for application. And these are the numbers that you can contact us on for more information. Thank you. Thank you very much. And I'll be happy to take any questions.
Thank you so much, Dr. Preeti. It was really a very informative session. And as a dental or a medical or a nursing student, mostly the students are not aware of the opportunities or the avenues they have beyond their core subjects. And moreover, your subject, public health, is the need of the hour. And government is also investing a lot of time and money in policy makings, in prevention, especially in the non-communicable diseases. So I think students have a good future if they take this course further as a career option. Students, do you have any questions you can ask? Dr. Preeti, I would request जो application वाले links हैं, जो procedure वाले, if you can share through email also to us, so that we can circulate that link in the student groups.
Sure, definitely.
Especially for the interns, we will circulate, because interns could not join much because they are in clinical duties, and these are the clinical hours. So mainly the interns will benefit more because they'll be like completing their internship and going out in the world.
Right.
So they might be needing it. तो आप वो share कर लीजिएगा, तो we will circulate it widely amongst all our intern groups.
Sure, I'll do that. Nareshi, please remind me that we need to share the links with them.
And
Sure.
Thank you, Naresh ji, for making this possible for the benefit of our students. And as a token of respect, we are now sharing a certificate for Dr. Preeti. It is on your screen. Thank you so much for taking out time for us. We will email the certificate to you.
Yes, thank you so much. Thank you.
Thank you so
Are
much.
there any questions from the students?
Students, if you want to ask anything, you can ask. Acha, Preeti ji, can the postgraduates also apply?
Yes, absolutely. The postgraduates, we do have a lot of people who have, completed their graduation a few years back, worked also, and then, or maybe done some other post-graduation, and then they come to us. That is also available. That possibility is also there. Yes.
Okay. So the fee structure and all is mentioned in your links.
It's all available in the brochures. It's all available on the website in the brochures. And we'll share the links with you once again. Naresh, please help me.
We will circulate the brochures, the timeline, and the links with the students so that they can benefit from more from it.
Right.
Okay. Thank you so much,
Thank you.
Preeti ji. Thank you, Naresh ji. Thank you all for joining today.
Thank you.
And
Thank you, Dr.
hope that we will have. Thank you so much. We will have more such interactive sessions with you in the future also.
Sure. Thank you. Thank you very much.
Thank you.
Have a nice weekend. Bye-bye.
Thank you.